So one of the biggest things you can do is if you're sick, if you're running a high fever, if you feel like you have the flu, if you're coughing and sneezing a lot, try not to spread it to your coworkers and patients and that sort of thing. So if you know you're sick, to stay home. That's going to be a big thing. Another thing that we're all familiar with is washing your hands often, especially if you blow your nose, cough, sneeze, those kind of things, then your hands are going to be more likely to have germs on them. Let's see, other things would be getting plenty of rest, plenty of fluids, taking good care of yourself through sort of cold and flu season, so in the fall and the winter. People who are sleep deprived tend to get more colds and flus, so helping with that can make a difference. So you want to wash your hands, if you work in the healthcare setting, then you want to wash your hands before and after seeing patients. Or if you're in an environment where you're exchanging money or shaking hands with people or any kind of exposure in that way, then you want to wash your hands often. Before eating is obviously a good time to think about it. Anytime your hands are visibly dirty, you'll want to wash your hands. And especially if, let's say, you have a small child or a baby or something like that, you may want to encourage other folks who are around that child to use the hand sanitizer as well. Okay. Some folks will carry around hand sanitizer this time of year because you may not always have access to a sink. So early on in any cold and flu is when you're actually going to be most contagious. Later in the course, when you're still got a runny nose or a cough, but you're kind of getting better, you're less contagious. So early on, when that first day or two tends to be the more contagious period. Also, when you have a fever, you tend to be more contagious. And anytime you're spreading something through the air, it's harder for you to control. So if you're coughing, sneezing, or if you're sharing drinks, of course, sharing foods or utensils or things like that with someone else, those are all going to be times that it's more contagious, versus if, let's say, you've got some sinus pressure, but you're not really sneezing, you're not running a fever, you're less likely to be spreading it. But that being said, if you know you have a cold, try to limit your exposure to other folks, wash your hands more often, that kind of thing. But certainly colds and flus, but also stomach flus, so when folks are having vomiting, diarrhea, that can be caused by viruses, it can be caused by food poisoning, or other causes. But if you've had vomiting and diarrhea, that certainly can be contagious. So you want to wash your hands often and try to limit exposure to folks who would get sicker with it, so babies, elderly. I would definitely recommend that things in the office that everybody's touching often, doorknobs, telephones, keyboards, are certainly a place that we spread things. And sometimes people also forget, you may shake someone's hand and then start using the phone, or, kind of spread germs in that way. So it's helpful, I think, to have a plan through the wintertime of just wiping those things down several times per day. Even, obviously wipe them down more often if you know that you've just been exposed, but wiping them down a couple times a day. So you can do that with an alcohol-based cleaner, or there's all kinds of antibacterial Lysol type products, things like that. And they do also make the spray that you can use for keyboards as well. But I would wipe those often, because I think we do, in a workplace, tend to spread germs pretty quickly. And that's probably a common way.